Friends, be it Kota in Rajasthan, Hyderabad in Telangana, or the national capital, one thing is common. They are all coaching hubs for highly competitive examinations such as JEE Main and Advanced for the premier Indian Institutes of Technology or IITs and the National Eligibility Cum Entrance Test NEET as we know for undergraduate medicine. Now eligibility, entrance tests and the aura around them is the topic for today. Friends, coaching class mania in our country has become a widespread phenomenon, deeply influencing the country's educational landscape. Driven by intense competition for limited seats in our prestigious institutions like the IITs, the IIMs, and top civil services, millions of students enroll in private coaching centers, often starting as early as middle school. Now this trend reflects both the aspirations of the families and the perceived inadequacies of the formal school systems. Now coaching classes promise expert guidance, rigorous testing and shortcut methods to crack entrance examinations. Now cities like Kota, Hyderabad and Delhi, to name a few, have become the coaching hubs, attracting students from across the country. Some centers operate like educational factories with strict schedules, high pressure environments and a singular focus on the success in those examinations. Now friends, the tenor of these centers is so intense and competitive that they completely lack empathy. So much so that Kota alone saw 26 deaths by suicide in 2023, the highest the city ever witnessed. Now over 100 died in the last 5 years. Over 2 lakh students go to Kota annually to prepare for competitive examinations. The current year has already seen its 6th suicide a few months back. Now that year after year students throng to these centers in spite of the rigors and the risks calls for a review of the entire ecosystem that has been created. Is it misplaced obsession with the IITs and the top medical institutions, or is it a genuine urge to do well in life? That's a difficult question to answer. What is the paradynamics of these tests? While initially students feel excited, motivated, and believe that they have already studied most of the syllabus and can clear the JEE without any coaching, 2 months down the line, they slowly start realizing that they, after all, are extremely tough. April sees very few students in the city. Then they come in droves as May and June approach. More the students, more the competition, and less are the marks they start scoring now. A few months more into the rigor, and many students start realizing that their class test scores are greatly decreasing and that they do not understand anything, despite sitting in the class for hours together. Students too find it inconvenient to ask questions in overcrowded classrooms. Consequently, demotivation sets in, which eventually takes more serious forms such as depression, passive feelings of sadness, hopelessness, and worthlessness, then catches on as the days pass by. Many cannot cope with the pressure, become extremely aloof, and start harboring thoughts of having let down their parents or themselves. Some may have anxiety disorders, leading to feelings of overwhelming fear and panic, and depressive episodes lead to impulsive decisions. Psychotic episodes and feelings of isolation, only increase the risks. The inability to cope with the stress, that trauma that they go through, or major life changes, persistent negative thoughts, and cognitive distortions, unable to realize the surroundings, exacerbate the mental health issues and lead to feelings of hopelessness and ultimately suicide. There could be other reasons as well, such as traumatic experiences, substance abuse, social isolation, loneliness, bullying, relationship problems, and financial stress. Now, whatever be the reason, the ambience is vitiated and turns toxic. There is no awareness of mental health among the students. The environment is so competitive that some students even harbor thoughts of competition reducing if more were to die. Lack of empathy and cutthroat competition just doesn't help anybody. There are students so depressed due to low marks that they score, they just lock themselves up and not come out of the room for days together. Unfortunately, no one checks on such instances. The coaching classes and other students around a depressed student at least must be taught to check on them. On the contrary, such cases go unnoticed till the patients call back complaining that their calls were going unanswered. Suicide is a complex and multifaceted issue influenced by various factors, often a combination of psychological, social, and biological elements. One needs to understand these factors if prevention strategies were to become effective. Promoting mental health awareness, creating a supporting environment, encouraging peer mentoring systems where students support each other, incorporating project-based assessments, presentations, and continuous evaluation to reduce the pressure of a single examination, and providing access to professional help are all important. Can we make Kota-like places safe for our children? Can we return to more saner methods of teaching and learning? Of course, access to affordable and effective mental health care, including therapy and medication, developing support networks through the community programs, will all be required. However, crisis intervention must be effective. It's like that's the lifeline. Providing immediate support through hotlines, crisis centers, and emergency services, creation of student helplines or help groups, building empathy among students is important. More than anything, both parents and the children must realize that admission into the best of the institutes is not the only goal in life. There are multiple opportunities available and even more to become useful in life. Probably educating parents on the importance of supporting their children emotionally and academically is the key. The parents must set realistic expectations and celebrate their children's efforts rather than just the outcomes. To address this issue, reforms are needed in school education, entrance exam structures, and mental health support systems. encouraging holistic development, career diversity, and equitable access to quality education is essential. Now, in conclusion, while coaching classes can be useful tools, the mania surrounding them leads to unhealthy, high stakes education culture, especially in our country. A balanced approach is crucial for the well being and the long term success of students. With that, friends, with that important message, I will end today's episode, leaving you to contemplate and introspect our attitudes in life and what we feel for our children. Thank you, Dhanyavad, and Namaskar.